Welcome to our video about membranous conjunctivitis, a relatively uncommon yet impactful eye condition. In this video, we'll explore what this disease is, its causes, how it affects your eye, and what can be done to treat it. So, let's dive in and shed some light on membranous conjunctivitis. Membranous conjunctivitis, as the name suggests, is characterized by the formation of a membrane on the conjunctiva, the clear tissue that covers the white part of your eye and the inside of your eyelids. This membrane isn't actually a normal structure of the eye. But what causes it to develop? The condition can arise from a variety of factors. In many cases, it's associated with bacterial infections, particularly those caused by Streptococcus species or Corynebacterium diphtheria, the bacteria responsible for diphtheria. Viral infections, such as adenovirus and herpes simplex virus, can also trigger it. Less frequently, membranous conjunctivitis can stem from autoimmune diseases like Stevens, Johnson syndrome, or mucous membrane pemphigoid. Chemical injuries and certain medications may also be contributing factors, though these are less common. To understand membranous conjunctivitis, we need to understand the pathophysiology. The initial trigger, whether infection, inflammation, or injury, leads to an inflammatory cascade in the conjunctiva. This cascade involves the release of inflammatory mediators that increase vascular permeability and cellular infiltration. The increased permeability allows fibrin and other proteins to leak from blood vessels and deposit on the conjunctival surface. Simultaneously, infiltrating immune cells, such as neutrophils and lymphocytes, contribute to the inflammatory milieu. This complex interplay of events results in the formation of a pseudomembrane or true membrane. A pseudomembrane is loosely adherent and composed of coagulated exudate, fibrin, and inflammatory cells. A true membrane, on the other hand, is more firmly adherent and involves actual epithelial cell necrosis. The membrane itself further irritates the conjunctiva, perpetuating the inflammatory cycle and potentially leading to scarring. Membranous conjunctivitis isn't a particularly common condition. Its incidence varies based on geographic location, hygiene practices, and the prevalence of the underlying causes. For instance, diphtheria-related membranous conjunctivitis is more common in regions where vaccination rates are low. Similarly, the incidence of adenovirus-related cases might fluctuate during seasonal outbreaks. While precise figures are hard to pinpoint, it's generally considered an infrequent presentation compared to other forms of conjunctivitis, like the common pink eye. The signs and symptoms of membranous conjunctivitis can be quite striking. The hallmark feature, of course, is the presence of a membrane on the conjunctiva. This membrane can range from a thin, translucent film to a thick, opaque layer. Patients often experience redness, pain, and a gritty or foreign body sensation in the eye. Excessive tearing and photophobia, or sensitivity to light, are also common. In severe cases, the membrane can cause significant discomfort, interfere with vision, and even lead to scarring of the conjunctiva. Removal of the membrane, if attempted, may result in bleeding. Diagnosing membranous conjunctivitis involves a thorough clinical examination. The doctor will carefully inspect the eye for the presence and characteristics of the membrane. A detailed medical history, including any recent infections, injuries, or medication use, is also crucial. To determine the underlying cause, conjunctival swabs may be taken for microbiological cultures and/or viral testing. In cases where systemic diseases are suspected, further blood tests or biopsies may be necessary to rule out autoimmune conditions or other contributing factors. While there aren't rigid classifications for membranous conjunctivitis, it's often categorized based on the nature of the membrane, whether it's a pseudomembrane or a true membrane, and the underlying etiology. Identifying the cause is essential for guiding treatment. The treatment for membranous conjunctivitis is primarily aimed at addressing the underlying cause and managing the symptoms. If a bacterial infection is identified, topical antibiotics are typically prescribed. For viral infections, antiviral medications may be considered, although supportive care is often the mainstay of treatment. In cases of autoimmune diseases, systemic immunosuppressants may be necessary. Removal of the membrane is sometimes performed, especially if it's causing significant discomfort or interfering with vision. However, removal should be done cautiously to avoid further trauma and bleeding. Topical corticosteroids can help reduce inflammation and prevent scarring. Artificial tears are also beneficial in lubricating the eye and alleviating dryness. Preventing membranous conjunctivitis largely depends on avoiding the underlying causes. Practicing good hygiene, such as frequent hand washing, can reduce the risk of bacterial and viral infections. Maintaining up-to-date vaccinations, especially against diphtheria, is crucial in preventing diphtheria-related cases. Protecting the eyes from chemical injuries and being aware of potential medication side effects can also help minimize the risk. The prognosis for membranous conjunctivitis varies depending on the underlying cause. the severity of the condition, and the timeliness of treatment. In many cases, with prompt and appropriate treatment, the condition resolves without any long-term complications. However, in severe cases, especially those involving true membranes or recurrent inflammation, scarring of the conjunctiva can occur, potentially leading to dry eye, restricted eye movement, or even vision impairment. Recent research is focusing on developing more effective anti-inflammatory therapies and strategies to prevent conjunctival scarring. Novel drug delivery systems, such as sustained-release implants, are also being explored to improve treatment outcomes and reduce the need for frequent eye drops. Further research into the specific molecular pathways involved in membrane formation may also lead to the development of targeted therapies that can prevent or reverse this condition.